In today's health headlines, Connecticut's high 10% positivity rate and low testing. News of a COVID outbreak on a cruise ship. And what is medium COVID? Joining us to tell us all about this is Dr. F. Perry Wilson. He's a Yale medicine physician and associate professor at Yale School of Medicine. Thanks for joining us once again today.
Thanks for having me.
Well, as I said, the Connecticut positivity rate is above 10% right now, but testing numbers are near an all-time low. How can we tell exactly what's really going on here?
It's honestly quite hard. The positivity rate doesn't really mean the same thing as it did a year ago when all the results of testing were recorded, because so many people now are testing at home and not reporting their results to state agencies. And so, hard to interpret. What we're looking at now are the sort of consequences of infections, which are things like hospitalizations. And I can say that hospitalizations are going up in Connecticut for COVID. And that suggests that, yeah, we are in the midst of something that's the beginning of a wave. I don't think it'll be as severe as the Omicron wave, but cases are rising and it is translating into meaningful outcomes like hospitalization.
All right, we're going to keep our fingers crossed that it doesn't go up too high, of course. Now, the CDC is also investigating a COVID outbreak on a Carnival cruise ship after lowering vaccination standards just last week. Now, summer is just around the corner. Should people now be avoiding this type of vacation?
Yeah, I mean, there are higher risk and lower risk activities, but I have to say that going on a cruise where you're in very close quarters and hallways, even if the cruise is mandating vaccination, remember that infections can still occur. And cruises are sort of notorious hotbeds for infectious disease outbreaks, even in the pre-coronavirus era. So this is really a high-risk activity, and I would encourage people who have any vulnerabilities or who are worried about COVID to probably stay away from cruises for some time.
All right, and some doctors have started using this term. It's called medium COVID to describe patients with mild initial infection who then go on to get hit hard with fatigue after recovery. What are you seeing?
Yeah, this is a phenomenon that it's a little hard to say whether it's new or not, because we're still kind of collecting data and looking back towards the early days of the pandemic. But we are certainly seeing people who have mild infection, even, a little bit of a runny nose or something. It clears up. And about a week to 10 days later, they just feel really beat down. Their exercise tolerance is lower. This is not severe enough to, land anyone in the hospital or anything, but it's definitely a phenomenon that's out there. We don't know exactly what's underlying it, but it does seem to be sort of a medium-term response to a COVID infection, hence the term medium COVID. We're going to keep a close eye on it.
All right. Now, I've got this last question for you as well. What's the COVID forecast for summer, and what should we expect concerning this?
That's always a very difficult question. I mean, if this summer behaves like prior summers, we should see cases go down a bit. As I said, we're seeing cases rise right now. As you may know, the White House just issued a warning that they anticipate up to 100 million new infections in the fall and winter, which tends to be the time that we see a bit of a seasonal increase as people move inside in the cold weather. It's really anyone's guess, but I think we have to be prepared that infections are going to rise and infections are going to fall. And so whatever you can do to protect yourself, which means get vaccinated and be careful in those large indoor crowds, you should probably continue to do.
All right. I'm going to hang on to that mask, Dr. Wilson. Thank you very much for joining us today, and you have a great week ahead.